Hi, my name is Heather Brewer. I'm an OBGYN at Monument Health in Spearfish. Overall, we don't have a lot of information about COVID and pregnancy because it's a new virus and we just don't have the data. It's going to take a while for that data to come in, so I just wanted to touch on a few things that we do know. We do know that pregnant women are at higher risk for respiratory illnesses, so we do want them to be careful. The data we have currently doesn't show that they're having more problems with COVID-19 than other patients who are not pregnant, but because of the risk with respiratory illnesses in pregnancy, we still consider them high-risk patients. So we still recommend that they are using good hand washing, staying away from people who are sick, good social distancing, wearing a mask when out in public. Regarding prenatal care, we are still seeing pregnant women in the office. For the most part, we feel like their visits are still necessary, and since we have a low amount of COVID currently in the community, we feel like they should be coming in for their visits. We have limited other patients coming into the clinic and trying to not have sick patients come into the visit to try and protect them as well. So you will be screened when you come into the clinic, asking if you've been ill, and then you will see us wearing masks in the clinic just to help protect you and to protect us. Most of the visits we do feel like are important. There are some visits that we may do telemedicine for, and those are things that we'll kind of explain as we go. You may see people getting more telemedicine visits in other locations because of a higher COVID population. We do still have visitor restrictions for the clinic where you cannot have any visitors with you, but you are allowed to have a visitor when you come to labor and delivery to have your baby. It is important to know, though, that that visitor has to be well. Both the patient and their significant other or support person will be screened, and if they do have signs of illness or have been exposed to a COVID patient, they won't be allowed in as a support person. So you should have a backup person ready for you if your spouse or your significant other is sick. Lastly, people are asking about their babies and what the risk is to their babies. We just don't have a lot of data right now about COVID and newborns. We do know there are some newborns who are getting COVID, but we don't know that that's occurring in utero. We feel like that's occurring after birth. There are some changes we will try and do if a patient is positive for COVID and they have a baby. We will try and protect the baby by separating them in the room by 6 feet and asking the mom to wear a mask if they're going to breastfeed versus pump and bottle feed the baby. So there are some things we're doing to help protect the moms and the babies, both in the clinic and in the hospital.